Which of the following pulses should be checked before administering digoxin? Options are A. Apical pulse, B. Radial pulse, C. Femoral pulse, D. Dorsalis pedis pulse. The answer is A. Apical pulse. Which of the following interventions must the nurse take when administering digoxin to the patient? A. Give him the medication with a glass of orange juice. B. Check him for signs of hypokalemia before giving the medication. C. Instruct him to place the medication under the tongue. D. Withhold the medication if his pulse is less than 60 beats per minute. The option is D. Withhold the medication if his pulse is less than 60 beats per minute. The nurse must withhold digoxin from a patient if his pulse rate is A. Less than 45 per minute, B. More than 60 per minute, C. Less than 60 per minute, D. More than 100 per minute. The answer is C. Less than 60 per minute. The nurse is assessing the client for a possible evidence of digitalis toxicity. The nurse acknowledges that which is included in the signs and symptoms for digitalis toxicity. The options are A. Pulse rate of 100 beats per minute, B. Pulse of 72 with an irregular rate, C. Pulse rate greater than 60 beats per minute and irregular rate, D. Pulse below 60 beats per minute and irregular rate. The answer is D. Pulse below 60 beats per minute and irregular rate. A newly admitted client take digoxin 0.25 mg per day. The nurse knows that the serum therapeutic range for digoxin is A. 0.1 to 1.5 nanogram per ml, B. 0.5 to 2.0 nanogram per ml, C. 1.0 to 2.5 nanogram per ml, D. 2.0 to 4.0 nanogram per ml. The answer is B. 0.5 to 2.0 nanogram per ml. A patient complains of severe pain which is stated to be 9/10. The physician ordered morphine 50 mg IV every 4 hours. The last dose was given 2 hours ago. What is the best action his caring nurse would take? The options are A. Give another dose of morphine, B. Inform the doctor to change the order, C. Distract the patient by TV, radio, game for 2 hours, D. Ignore the patient completely. The answer is option B. Inform the doctor to change the order. The nurse is caring for a patient admitted 1 week ago with an acute spinal cord injury. Which of the following assessment findings would alert the nurse to the presence of autonomic dysreflexia? A. Tachycardia, B. Hypotension, C. Hot dry skin, D. Throbbing headache. The answer is D. Throbbing headache. Which of the following is the best way for long-term feeding for a patient experiencing severe dysphagia? A. NG tube, B. Nasoduodenal tube, C. Gastrostomy, D. Parenteral. The option is C. Gastrostomy. Patient records are as following. He had 650 cc of IV fluid, 50 ml of orange juice in the NG tube, 100 water with the medication, and urinate 500 cc and 100 cc collected in the NG bag. What is the total intake for this patient? A. 800 cc, B. 650 cc, C. 200 cc, D. 600 cc. The right answer is A. 800 cc. The physician ordered to give the patient 10,000 units of heparin. The preparation available is 40,000 per ml. How much would the nurse give this patient? A. 4 ml, B. 2.5 ml, C. 0.25 ml, D. 25 ml. The option is C. 0.25 ml. The nurse is caring for a client with a fracture. The client develops a deep vein thrombosis in the opposite extremity. Physician orders include a heparin drip of D5 250 ml with heparin 12,500 units at 16 ml per hour. How many units of heparin is this Client receiving per hour. Option A 200 units per hour, B 400 unit per hour, C 600 unit per hour, D 800 unit per hour. The option is D 800 unit per hour. A patient suffers from diarrhea and muscle weakness. The nurse would assess this patient for which of the following abnormal laboratory blood tests? Option A blood calcium, B blood magnesium, C blood potassium, D blood sodium. The option is C blood potassium. When assessing for therapeutic effects of mannitol, the nurse would expect to see A. Decreased intracranial pressure, B. Decreased excretion of therapeutic medications, C. Increased urine osmolarity, D. Decreased serum osmolality. The option is A. Decreased intracranial pressure. Which drug would be used to treat a patient who has increased intracranial pressure resulting from head trauma after an accident? A. Mannitol, B. Atropine sulfate, C. Epinephrine hydrochloride, D. Sodium bicarbonate. The answer is A. Mannitol. Which of the following is the drug of choice for treatment of cerebral edema? A. Mannitol, B. Atropine sulfate, C. Epinephrine hydrochloride, D. Sodium bicarbonate. The answer is A. Mannitol. A patient who has been anticoagulated with warfarin is admitted with gastrointestinal bleeding. The nurse will anticipate administering which substance? A. Vitamin E, B. Vitamin K, C. Protamine sulfate, D. Calcium gluconate. The answer is B. Vitamin K.